Please keep the internal rotation gains that we've made. And if you're wondering how you're gonna get into an awkward position like that in the days and what to promote to not lose it, for sitting, doesn't matter where you are, but mostly if you're working, because that's when you become absent-minded, right? Feet wider, they can be flat, but probably you're gonna be on the insides of your feet. You could have no block or ball, or you could have a block or ball. Random squeezes whenever you can, or just to have it there so that you're holding something and you don't fall into this position under the desk, or just be here for a bit, time it during your break. So that's sitting. Lying on your side, bend up 90-90. Make sure the top leg is stacked on top of the bottom. It is the bottom leg that will be internally rotating. You want to avoid knee pain. And so you're letting gravity swing you over to pendulum down that way in order to get internal rotation at the hip. The caveat with these things is that you're not trying to feel anything here. That's just impingement. There is no crease sensation you should be promoting. So same thing, other side, 90-90, swing down, no crease pain is allowed, okay? Lying on your back. You could do the whole pole thing where you go underneath and inside the foot, and then you're turning like this. You can keep this position in a way that you're lying flat and you know if anything's deviating, because you shouldn't arch your back or hike your hip, okay? Or you could merely drop in. You can even compare when you drop in which one's more limited. This one's more limited for me, so then I would put some weight on it and hang out and make sure I could get some symmetry. And then, of course, you know me, if you have limitations, it would be great if you're gonna bother to sit in these positions that you have your mobility band anchored somewhere and you promote these while it's pulling in order for your hip joint to be assisted. So that way, say if you were feeling a crease or joint line pinch and it pulled and you were able to perform it without that pinch, you know that your joint's getting assisted to move in the direction it needs in order for you to attain the motion without a joint pinch.